Hello, everyone. Good afternoon. It is Thursday, June 4th. I'm Randy Murphy, epidemiologist and Director of Disease Surveillance at the Mobile County Health Department. We're here to provide you with our daily update on the impact of COVID-19 pandemic on Mobile County. First, we will start with some global numbers. So worldwide, been approximately 6.5 million cases of COVID-19 disease with over 380,000 deaths. Again, those are the global numbers. In the United States, greater than 1.8 million COVID-19 cases with about 107,000 deaths. And in Alabama this morning, the dashboard was showing around 19,000 cases with greater than 650 deaths. In Mobile today, we're reporting on 2,330 cases of patients with COVID-19 disease. 2,321 of those were laboratory confirmed and 9 probable. There's a minor discrepancy in our daily report today. The daily increase, actually yesterday, 38 cases were added on June 3rd. Again, we're seeing about 11% hospitalized and around 5% died with COVID disease at this point. I had talked Tuesday and Monday about my concern about the number of reported cases going down, and that I wasn't sure if that might be due to the Memorial Day holiday, and we knew that fewer people were getting tested, or it appeared that way, and it continued to go down, and I was not quite sure what to take of that. And today, the Alabama Department of Public Health released a statement explaining that due to a large increase in volume of COVID-19 laboratory results being processed by laboratories, this is nationally, state public health labs, commercial labs, hospital labs, etc., and sent to state health departments, the national surveillance pipeline is becoming overwhelmed and is causing delays. Please be patient as the Centers for Disease Control and Prevention, the Alabama Department of Public Health, and its vendor work to address these growing pains. So again, just to make sure that you recognize or appreciate or understand that what we are seeing in the decline over the last couple of days is likely due part or potentially whole in the fracturing or instability of the national network of disease surveillance, and CDC and states and their vendors are working to improve that. So I think they're going to try to push a software patch over the weekend that they hope will change things. All of the results are still coming in, so we've not lost any information, but we actually can't sort of count it as reported until the electronic laboratory result is picked up by an investigator and assigned in the system. And because of the frailty of the overloaded systems right now, it's not easy for the investigators to go into the software application and do that work. It stalls, it takes much longer, it'll just shut down. The servers have been down for some time, parts of the day. So that is causing a delay, and likely, like I said, either it definitely is part or potentially all of the explanation behind why we have been seeing increasingly lower number of cases reported to us. Until yesterday, it went back up to around normal, which was 38 cases added on June 3rd. So some information for you there. Want to address a couple of questions here from the media and Facebook. Someone from the media asked about the fact that we had no deaths reported for the past few days in Mobile County. Is it attributable to getting a handle on long-term care facility outbreaks where 60% of our deaths are known to be linked, or are we just lucky? So I think the explanation that I just gave explains why we may not have seen deaths reported over the past couple of days. It may be due to a delay in being able to investigate labs that are in that surveillance system. Let's see, here's another one. Have therapeutic treatments begin to show results, plasma from recovered patients or remdesivir? Yes, we I don't have any systematic data collection to share with you, but we hear anecdotally from providers in the hospitals that plasma from recovered patients is helpful, and that remdesivir is providing improvement, which is sort of turning the tide on these negative outcomes that can occur once a patient is requires intensive care or requires mechanical ventilation. So we are hearing encouraging information coming back to us about the use of remdesivir and plasma. Has the virus mutated enough to lessen the effects on hosts? I don't have any science behind this question, but I was on a CDC call earlier this week. They were talking about a few different genetic versions of the virus, and it depended on whether or not you were infected in Europe or in China, but it has not mutated to a degree that it's become less virulent to host. Just some minor differences in the genetic makeup depending on where the virus is circulating, and again, that happens after it passes through humans many times. Here's a comment from someone in the media. I don't say this often, but someone in the media said Dr. Murphy was right. Case numbers went back up after 4 days of decline. So yeah, they were back up yesterday, but again, until we get news from ADPH, CDC, and the software vendor, and again, this is a national problem, not just for Alabama, because the same vendor provides disease surveillance for something like 30 or more states. So we will probably not see things get back to normal for a few days, and then we are likely to see a large spike. And again, these are just normal surveillance aberrations that are noted when you're relying on report date as your indicator for your graph or your chart or your line, because report date is influenced by so many different factors that have nothing to do with the natural course of the disease. So when I look at it on the back end, I try to look at this date that is called event date when I'm taking a look at the trends, because it takes the date closest to your known COVID event, and so that we can look at, for example, symptom onset date or the date your specimen was collected for positive, and it sort of sets aside some of the bias that is introduced when you're looking at the data by report date. Because again, we have learned throughout this event that many things affect that have nothing to do with the natural course of the disease. Okay, Facebook question: since the riots began, it seems like COVID-19 just disappeared off the face of the earth. Now, what is up with that? Yeah, there is lots of competition for the news these days. We, in Mobile County, in the weeks leading up, before the month or so leading up to the COVID outbreak, I was trying to get some press time or some media time around the hepatitis A virus outbreak that's going on in Mobile County, and it's continuing to go on. So as soon as COVID came along, nobody seemed to talk about the hepatitis A outbreak anymore, because we were also overwhelmed with COVID. And yes, when we see things that come up in the news that are affecting our nation, it is, I think, only natural for us to turn our attention to that, at least for some length of time, sometimes just briefly, but depends on how that grows. I'll talk with you in just a few minutes about something else that I want to make sure is on your radar and is on the radar of our local media outlets, and that is the looming storm in the Gulf of Mexico. So more about that, but yes, there's always something competing for those sound bites in newsprint, online, social media, and on TV. So here's just a comment saying that thanks for the information, and a question that curious if there are any prominent drivers of new cases like long-term care facilities, meatpacking plants, other workplaces in Mobile. We have not seen large clusters of disease at facilities other than congregate settings. Yes, we hear of a case or two in employers, but so far we have not seen something that really stands out as being transmission at a workplace other than a healthcare facility or a detention center. And then this Facebook message goes on to say, talk about the UAB symptom tracker and symptoms in Mississippi. Any reason for that? So what UAB is doing, the University of Alabama in Birmingham, I think on May 26th, returned graduate students and faculty to their campus, and they are using a symptom tracker app that all of the faculty and staff that are returning and grad students must be enrolled in this app that UAB developed that tracks the symptoms. I think it sends you a text message, or you have to go online in the app and answer the symptom questions maybe every couple of days. And I've not seen any data come out of that. It looks like maybe one of our viewers has. We are not utilizing the UAB tracker in any way at this point, but the Alabama Department of Public Health is working with UAB and with Apple and Google on some other electronic solutions to contact tracing or symptom tracker. Alabama Department of Public Health is also looking at something called Sarah Alert to assist us in electronic contacts monitoring. So you will begin to see some of those more electronic or app-based solutions for symptom monitoring, contact tracing, that sort of thing in the coming future. And that's, again, being driven by our partners at the Alabama Department of Public Health. And as they procure and implement electronic mechanisms for case investigation or contact tracing, we will participate in that for sure, but we will always have, of course, human investigators working on those things behind the scene. See, here was another question about can we determine if the diagnosis results are higher due to more testing or actually the state reopening too soon? It's not more testing, that's not driving the numbers up, and it's been difficult to see what the true impact of the loosening of the restrictions right before Memorial Day because of this interruption in data flow with the state's surveillance system. So we may not be able to tell the full effect of people being out and about on Memorial Day until for at least 2 weeks, another 7 days or so, and definitely until the surveillance system is back online and fully functioning in its capacity. Here is a question about zip codes, asking about the way that we report zip codes. So we only report the numerator, so we only report the number of cases for zip codes that have at least 20,000 people living in them. For all of the other zip codes, we group them. So all of the other 365 something something zip codes, the cases for all of those 365 something something zip codes are condensed in other 365 in our report. And the same thing goes with other 366. We take the cases from all the 366 something something zip codes and lump them together and report those as other 366. So I hope that that clarifies that, and thank you for that question, because certainly if one person doesn't understand the way I've presented the information or we've presented it, then others will have questions too, so thank you for asking that. Just wanted to give a couple of, I always try to share some information from some of the newer CDC guidance, and this came out a couple of days ago, maybe last week sometime, about safe transportation. So CDC has a new web page called Protect Yourself When Using Transportation, and offers advice on staying healthy while using public transit, ride shares, taxis, and micro mobility devices such as scooters and also personal vehicles. So it lists general considerations for all types of transportation, like practicing respiratory etiquette and washing hands after exiting transportation, practicing social distancing, wearing cloth face coverings, staying home when appropriate. And then it also provides specific tips for public transportation, so avoiding or minimizing touch surfaces such as kiosks, touch screens, and turnstiles, for ride shares and taxis to improve ventilation by opening windows and asking the driver to place vents or air conditioning on fresh air instead of recirculating air, and then avoiding contact with frequently touched surfaces such as doors and window handles. And then for micro mobility devices, that's a term I have not heard before, like shared scooters and bikes, clean and disinfect surfaces such as handlebars before riding. So some tips there, particularly if you live in the more urban areas of Mobile and depend on ride shares or what do they call it, micro mobility devices. Also, I was asked today to give my thoughts on football, club football opening back up for, small children all the way through, high schoolers. And please visit the ADPH website. There is a lot of guidance there, and there's a flyer specifically on adult and youth athletic activities. And I just want to reiterate that you must keep a 6-foot distance between people of different households off the field of play when practical and on the field of play. So whether you're on the field or off the field, the 6-foot rule still applies, whether you're wearing a mask or not wearing a mask. And there are lots of other things in here, information about, when you are sharing equipment, when you have shared water, for example, or Gatorade or other hydration drinks, lots of information about, what to do about, refraining from high fives and handshakes and other physical contact. So these are things that are not easily accomplished with any athletic activity, and certainly a lot more difficult with younger children. So please read this guidance carefully if you are contemplating doing any adult or youth athletic activities this summer. So before I give my last message, let me just ask, are there any Facebook questions or media questions? Okay, thank you. I just wanted to remind you that the Mobile County Health Department, Family Health, our primary care division of the health department, is offering testing for COVID-19, PCR testing, to anyone who thinks they need a COVID test, regardless of your ability to pay. We'd prefer that you make an appointment by calling 251-690-8889. But if you come to the downtown location, you can maybe call as you're driving, and we have capacity. We're not overrun, so please, try to call ahead, 251-690-8889. And if you're not able to get down here, again, it's Monday through Friday, 9 to 3:30, I think. Yes, I'm getting a thumbs up on that. Do you know if they're going to be testing tomorrow? Did we get that answered ever? We'll find out about that and let you know. Our downtown Keeler location is going to be open for the first time since COVID shut us down. Well, not shut us down, but restricted our activities. It's going to be open, our Saturday clinic, but I'll give you some more information about that tomorrow. Mark will remind me. All right. The last thing, and I'll talk to you about this tomorrow, and please, if you are a media outlet watching this live or watching it as a recording, I am really asking for your help to get this message out. The health department is encouraging everyone to prepare for hurricane season in light of the COVID-19 pandemic. We have a tropical depression in the Gulf that likely will become a tropical storm again. Check with the Emergency Management Agency, your local news outlets, to see where the cone is. So what areas might be affected by the cone of the hurricane that could include high winds and area flooding, particularly coastal flooding and flooding along the rivers and other tributaries. We don't want you to rely on a shelter if you have to evacuate and get to higher ground to avoid the difficulties associated and the dangers associated with high water. We know that during storms, it's high water that causes the most morbidity. So we want you to have a plan, put some extra things in your Hurricane Go kit, like face masks and cloth face coverings and bar of soap and a washcloth, or hand sanitizer if you have it, other disinfectants, and identify a place to shelter if, other than a congregate shelter or a mass shelter. This is really important in light of the COVID-19 pandemic, where we know that transmission is much higher in congregate settings. It would be very difficult for us to maintain 6 foot distance and keep non-households apart from each other if we have to open shelters during before, during, or after a hurricane. So please use shelters as a last resort. Find a safe place to shelter and have several ways to receive weather alerts, including cell phones, weather radios, the local news. We really want to, to send this message strong to please prepare. They're coming early this year, it seems. This is our third named storm, so please take it very seriously. And if you need to evacuate, include personal items in your go kit that will help you stay COVID-free while you evacuate and shelter. All right, and with that, I will end our report for today, and we will talk to you again tomorrow.